A lot of this stuff you may already know or may not be a factor for you, but I just wanted to get the information out there. A little bit about me. I grew up in a rural community located in Northern Virginia right now, kind of on the edge of farm country in the suburbs. My office is in Springfield, Virginia, outside of DC. I was going to shoot this in front of the apple trees or the raised beds, or you get the rabbit tractor behind me here, but it's sunny, it's early summer, it's too hot, it's too bright. So figured I'd shoot it with the edge of the woods here. Got the wineberries and blackberries that are around the property behind me. Hopefully you guys in the community find this to be helpful. Why do I consider dentistry to be a survival topic? Well, one, people with healthy teeth and gums literally live 7 to 10 years longer. And that's controlled for socioeconomic and other health factors and things like that. Two, I know that mouth kind of got separated from the body at some point in modern medicine, but it's tied to so many health related issues. Gum disease tied to heart attack, stroke, diabetes, cancer, dementia. There's so many things that oral health is tied to. So that's one aspect. Two, the number one reason kids miss school and one of the top reasons adults miss work is for toothaches. Money is a survival issue. Most of this will be spent on money and prevention, except for a couple points here and there that I thought might be fun or interesting to the community, or lifestyle things that don't really have to do with prevention or time and money. I thought about doing this video a couple different ways, but what I decided to do was, so you guys can see the questions and skip between videos, I'm gonna splice myself in asking the question on camera with a white jacket on in my house, and then I'm gonna cut to the answers here. Why do we have to brush and floss? And why do you consider that more important than showering? What home care regimen do you recommend? The reason we have to brush and floss is the teeth are literally the only surface in the body that doesn't shed. So if you don't shower, eventually the skin's gonna shred off, the hair's gonna fall or cut out. The tooth is the only non-shedding surface in the body. So you have to physically remove the bacteria that build up in it. We've got bacteria that line our entire digestive tract. There are a couple that cause gum disease. There's one that causes cavities. Different people have different bacteria in the mouth. We're in an age now where you can get that tested if you want. They accumulate on the tooth and they have to be physically removed. There's one type of bacteria that causes cavities. There's a bunch that cause gum disease, but you have to brush it off and then you have to do something to get between the teeth. The number one brush, hands down, is a sonic hair, unquestionably. The sonic action actually breaks up plaque through water. People also brush longer with it. Try it. You can get one for $40 on Amazon. You do have to switch the heads out regularly like you would a regular brush. It is about the same cost as a regular toothbrush when you switch the heads. But that $40 is probably the best time or money you'll spend out of anything else I go over. That'll get most surface of the tooth. You got to get something to go between it. I like floss. I know the floss picks are popular now. I would say regular floss is a hair better. You could do a water pick. That's recommended for some people. Average person without gum disease, I'd probably say flossing is better. But you got to do something to get between the teeth. So if you don't like to floss picks, water pick, they make little brushes that go between, but you got to do something to get in there. Most people, their cavity and gum disease start between the teeth because only 10% of the country flosses. That's a little bit about brushing and flossing, why we have to do it, what I'd recommend. That one thing alone will save you a ton of time and money. Talk to us more about diet and oral health as it relates to sugar. It's frequent exposure to sugar that causes cavities. Cavities didn't exist until the sugar trade, 150 years ago. So frequent exposure to sugar causes cavities. Honey, although I would say much better for you than high fructose corn syrup, the bacteria in your mouth don't care. It's still sugar to them. And lemon. There's a lot of sugar in lemon. So if you like an iced tea, I enjoy iced tea, and you're gonna put honey or lemon in it, keep it to meal times. So you can pretty much eat whatever you want 3 or 4 times a day. It's frequent exposure to sugar between meals that's gonna give you cavities. Once the bacteria in your mouth gets sugar, they make acid for 20 minutes. The acid dissolves the tooth and makes a cavity. So we talked about brushing, get the bacteria off the teeth, keeping the sugar down. That's gonna keep them off the teeth. We're gonna get into a little bit of some other things you can do, xylitol and some other things to get that bacteria shifted in your mouth as well. What is periodontal disease and how can it be avoided? So cavity is one of the big things. Eventually it's going to get into the nerve, cause a toothache, and that's what leads to missing work and time and money. Dentistry, it's mostly about prevention, better to get it small. The diet and the brushing will pretty much take care of cavities your whole life. It will not take care of gum disease. So gum disease has been around for thousands and thousands of years, tens of thousands of years. Any skulls that are found that are over 10,000 years old, there's periodontal disease in them. That will happen no matter how well you brush and floss if you don't see a dentist on at least some frequency. Within 24 to 48 hours, the bacteria, if left in your mouth, so you go one day without brushing or flossing, the minerals in saliva that keep your teeth from dissolving, they start to deposit on that plaque and it grows kind of like a coral reef. So the inner layer is calcified, the outer layer is active and toxic and releasing things that hurt the gums. So that outer toxic layer of bacteria, the type of bacteria it is, it doesn't grow right on the tooth. The bad ones grow on other plaque and bacteria. So it really does have to grow kind of like a coral reef. So it's a microenvironment, that same kind of idea. except this is not what you want in there. You want that surface smooth, clean, nothing on it. That outer layer is going to release toxins. The toxins are going to cause your gums to be inflamed, and it's going to cause the bone to pull back. Gum disease is multifactorial. We talked about the brushing. That's one factor. The other factor is bacteria in your mouth. We live in a day and age now where you can get that tested. If you're having issues with gum disease, there are things you can do to test that and shift it. The third thing is having it physically removed at the dentist. Well, the third thing is your genetics, but you can't really control that. So it is like cancer, it's multifactorial, but those are the three things: brushing and flossing, frequency of cleanings, genetics, and the type of bacteria in your mouth. No matter how well you brush and floss, you're going to build something on your teeth over time. The average recommendation is 6 months. Once you have gum disease, you have to get it done every 3 to 4 months. The bacteria will build up again. They will cause damage. They will cause bone loss. So you need to be seeing healthcare professional, a dentist, hygienist on some level of frequency to get your teeth cleaned, or it will lead to gum disease. Once you lose the bone, you cannot get it back. So again, prevention, the whole idea is save money, save time, stay healthy. How do alcohol, tobacco, and HPV relate to the risk of oral cancer? HPV and oral cancer are on the rise. So even though tobacco usage has gone down, increased alcohol usage and more permissive sexual activities have led to an increased oral cancer prevalence in the United States in the last decades. I absolutely recommend the HPV vaccine, not for sexual reasons, but for oral health reasons. So there are a number of, most of you are probably aware, like HPV can cause cervical cancer. It causes oral cancer too. Some HPVs are sexually transmitted. Some of them are orally transmitted. So most kids do pick it up when they're younger. Once they get into preschool, they're going to start interacting with other kids, sharing water bottles, things like that. They're going to pick it up. 70% of adult population has it. I recommend it for men and women. Obviously, women are only subject to the cervical cancer. Both men and women are subject to oral cancer, more prevalent in men, actually. I would absolutely get that vaccine, not for anything to do with sexual reasons or anything else, just 100% for oral cancer prevention. One last thing on oral cancer, there's been a lot of new therapies for cancer. Oral cancer, if you get it, you just got to catch it early. Cut out half of the tongue if it's on your tongue, cut out the cheek if it's on your cheek. Unfortunately, my uncle just lost his whole tongue. So this is something that does negatively impact your quality of life pretty significantly if you get it. And even if you don't have teeth, you have dentures once a year with the dentist for an oral health screening for cancer. I had a patient during COVID. She came in, she thought, I might cancel my appointment, COVID and whatnot. Caught something on her tongue that day. She wasn't even there for exams. She's just there for her filling. Got her into the oral surgeon. She only lost a small little sliver of her tongue. So she thanks me every time I see her. It's part of our job. It's part of what we do. If you're at this point, you're hearing things that you haven't heard from your dentist, I would suggest you find another dentist, honestly. What is xylitol and hydroxyapatite, and how can they help with cavity prevention? So this will be probably the hot button topic of the video, because I'm going to touch on fluoride briefly. So I'm sure there are people that don't like fluoride, don't want it in their water. I get that. I'm not going to change your opinion on that. I'll say a couple things. One, fluoride is more studied than cancer, heart attacks, strokes combined. The evidence that it is effective is irrefutable. I've had personal experiences with patients who cut fluoride out, who I saw them for 7 to 10 years, no cavities, they cut fluoride out, 1 or 2 cavities per year now. So it absolutely 100% will reduce your risk of cavities. Let's talk about it in the water. The reasons it's in the water is for taking it out of the water, it's only going to hurt the poor and the young. Up until age 12, the fluoride can be incorporated into the actual tooth structure. Past age 12, there's no reason for it to be in the water, honestly, but we can't have 2 different types of water for different people. I know there are studies out there talk about like calcification of pineal gland, whatever. They weren't super well controlled. Fluoride's a natural element. That person might have had a higher concentration in their water, well water, something like that. It is in a lot of well water. If it's not, you can get yours tested. But past the age of 12, the benefits of fluoride are all topical. So fluoridated tooth rinse, fluoride mouth rinse, fluoride toothpaste, you're good to go. But up to the age of 12, it can actually be incorporated in the tooth. But like I said, I'm not going to change anyone's mind on fluoride in a 3-minute video. So if you're a non-fluoride person, there's 2 things you should do. 1, hydroxyapatite. Works completely differently. What fluoride does is it incorporates into the outer tooth structure, the enamel. It makes it more resistant to acid and thus more resistant to decay. If you're non-fluoride, there's 2 things you can do. And these work for everyone, but highly recommended if you don't use fluoride. There's only one other thing that's been shown to remineralize teeth, and that's hydroxyapatite. Been out for 30 plus years. The problem is 20, 30 years ago, you had to buy it from your dentist. It's $30 a tube. With Amazon and things now, you can get MI Paste, GC America. That's what's been out for 30 years, high quality product. It's about $23. So it's cheaper than it was 20 years ago, and inflation adjusted, it's a lot cheaper. But it's still 5 times the cost of a $3 tube of toothpaste, at least. So you're looking at around 20, 23 bucks on Amazon for hydroxyapatite. GC's been the one, MI Paste been the one that's out forever. That's a high quality product. Recently, I've seen a bunch of hydroxyapatite stuff hit the market last year or two. A lot of it's cheaper. I can't speak to the quality on any of that stuff. So hopefully it's from a reputable vendor and it's good stuff. I don't know about stuff coming out of China or stuff like that. So if you're high cavity risk and you want to do fluoride and hydroxyapatite, that would be the number one. If you just want to do one thing and you're non-fluoride, go hydroxyapatite. This other thing I'm going to say is good for anyone. There's one type of bacteria in the mouth that makes cavities. That bacteria has 2 different metabolism paths. One is real sugar, the other is sugar alcohols. If you have a lot of sugar alcohols, which is what's in like sugar-free, like protein shakes and stuff, our body tastes it as sweet, we consume it as sugar. The bacteria, in order to consume that, have to switch their metabolism up to metabolize sugar alcohols. And when they do get the actual raw sugar, they won't be able to make as much acid. So that's why I say it's good for everyone. The one that's been shown to actually decrease cavity risk is xylitol. So xylitol is not popular in the United States for tariff reasons. It's more popular in Canada and Japan, and that way for years. But again, with Amazon now, you can get whatever you want online. Xylitol gum is great. Frequent exposure to xylitol is great. The number one way to get it is through, gum or mints or something like that. I do like chewing gum after meals, just kind of physically clean the teeth a little bit. And xylitol is easy to find in chewing gum. The 2 US brands that I know that has xylitol as the number one ingredient over like sorbitol or something else are Mentos and Icebreakers. But you can get a lot of different gums from like Japan and Canada and stuff that are like straight xylitol. So hopefully for you non-fluoride people, that helps you out with cavities. What is TMD, and talk to us a bit about grinding and stress? So TMJ, TMJD, it's just a fancy name for the jaw joint, mandible, temporal bone in the skull. That's where the initials come from. There's a disc in there. This joint is unlike any other joint in the body. There's an innervated disc in there. Pretty much everyone clenches and grinds their teeth a little bit at night. The people we say do it are the ones we see the wear on or have symptoms. In 20 years of practice, I don't think I've ever had a male come to me with symptoms. That being said, I give myself Botox every 3 months. It feels great. And when I don't get it, I can feel the tension in this muscle area. Botox is expensive. I give it to myself because I have it on hand and then I have to throw it out anyway. The best way to prevent clenching and grinding of the teeth is a night guard. It's a piece of plastic. You put it on your teeth. It keeps you from grinding down the teeth. It just grinds down the plastic instead. If you are seeing signs of wear on your teeth, that's not healthy. That's not normal wear. That's parafunctional wear from clenching and grinding your teeth. So when we bite on a popcorn kernel, you know to stop. That's a protective reflex to keep you from destroying your teeth. At night, that doesn't happen. A lot of force on the teeth, grinding, they wear down. By the time, if you can look at the front of your teeth and see like a ring on the outside, like a tree ring almost on the inner part of the core, you can see that. That means you already ground down 2 or 3 millimeters. So this is a slow process, 1 to 2 millimeters per decade. But if a dentist is advising you a guard, I would absolutely get it. We are not allowed to recommend over-the-counter appliances because they give some people problems. I tell my patients routinely, if you don't have any tension or stress through here and you want to try an over-the-counter product just to protect your teeth, go for it. I can't legally recommend that to you. So you can go get one at Dick's for 20 bucks or whatever. But the problem is some people, it acts like a chew toy and then it develops stress and problems in the joint. An actual guard is set with a flat surface, a ramp in the front to de-stress the muscles. You can test this yourself at home. Clench down hard and you feel these muscles here. You got 3 big closer muscles and 1 tiny opener muscle. It's the opener muscle that gets fatigued and sore. If you take a pen and bite on the tip of the pen, you'll see these muscles don't fire anymore. So the ramp on the front is designed to deactivate the higher grinding muscles in the back, decrease the tension on the joint and the muscles. An over-the-counter product won't do that, but it will protect the teeth from the wear. Take that information as you will. I wish more dentists would be more proactive about talking to people about grinding their teeth. We saw a huge spike during COVID, just the stress and everything, people grinding, breaking teeth. It is stress related. The only things you could do that have been shown to decrease it other than the guard would be like take a break app or a stress app at night, like a guided meditation, breathing, yoga, something like that at night before bed, or exercise. Those are the other 2 things that have been shown to decrease it. But the only thing to do to protect it is to put a piece of plastic in there. A properly designed piece of plastic will de-stress the joint and muscles also. A non-properly designed one, whether it's from the store or a dentist who doesn't know what they're doing, will not. So if you develop symptoms, that means you're severely doing it But if you're seeing the wear patterns on your teeth or you have symptoms, I would absolutely advise it. If you get into your 60s and you're like, well, my teeth are too short, it's 60 grand to reopen your bite back up. You have to crown every single tooth from the mouth, or at least half. It's extremely expensive. So again, most of this video is on just trying to save people money. From what we've covered, HPV vaccine, I don't know what they cost, they're probably cheap. Brushing, $40 Sonicare, going for routine checkups, and a guard for less than $1,000, you're pretty much preventing pretty much almost every problem you're going to have. Then maybe one visit to the dentist per year. But like I said, if you got gum disease, you got to go 3 or 4 times.
What is the relation between dental health and snoring and sleep apnea?
I have a lot of gripes with the medical community. One of my big one right now is people who are diagnosed with mild sleep apnea and their doctor telling them, oh, it's mild. Sleep apnea will take 5 to 10 years off your life. What snoring is the tongue collapsing against the back of the throat. Sleep apnea, if it gets stuck there, this is obstructive sleep apnea. There are different types of sleep apnea. When I say sleep apnea, I mean obstructive sleep apnea. Stuck there 10 seconds or more, 5 or more times per hour is the lowest bar for mild. Up to 15 times per hour is still mild. If you grab a pulse ox off Amazon for $15 and try to get your pulse ox below 90, I guarantee 99% of you won't be able to do it. Maybe some divers, stuff like that, you might be able to push it. If you were in the hospital and that happened, you'd code. So they'd be in there with a cart. Imagine that happening 15 times per hour every night. Sleep is one of the #1 things that will increase your lifespan. If you can't sleep well because you can't breathe, you're gonna take 5 or 10 years off your life. There's 1 dental treatment for sleep apnea. There's 3 medical treatments. I really don't care which one you get. On the medical side, you've got surgically opening up the airway tube to make it bigger, take out adenoids, tonsils, things like that. Some people are candidates, some people are. 2, you've got something new the last couple of years called Inspire. Goes in here, turn it on like a little key fob at night before you go to bed, stimulates the airway open. My father-in-law's got it, he likes that. I have a buddy who did the airway opening surgery, a lot of patients who have. It's gonna be hard to swallow for a couple of days, but then it's gonna be great. Option number 3, most people know about it, the air mask, positively pushing air down your throat so that your tube stays open. Option number 4, the dental option. They all work the same way. They all hold your lower jaw forward. It opens up the airway, keeps the tongue from collapsing against the back of the throat. Again, you can do this yourself at home. So you wanna breathe in through your nose. Nasal breathing gives you more oxygen for a number of reasons, but you wanna breathe in through your mouth for this. So if you breathe in through your mouth and then you open up your jaw and slide it forward and breathe in again, you can feel how much more air gets in there. So that's all the dental appliance is doing. It's holding the tongue forward, pulling it off the back of the throat, opening up the airway so more air gets in, the tube can't collapse. That's good if you have sleep apnea. What's better is if when your child is around 8 to 12, they're properly evaluated by a good dentist or pediatric dentist or orthodontist for jaw growth and development. So the roof of the mouth is the floor of the nose. A lot of people, their jaw doesn't develop as much as it should. And there are appliances that can be given at any time in life, but are great during that 6 to 12 period to help develop the jaw. So the roof of the mouth is the floor of the nose. The wider it gets, the more nasal breathing you will get. And that is superior to breathing through your mouth. So that's something that can be done at any time by a dentist to develop the airway and the jaws. I'd recommend that if your jaw is restricted. The dental appliance can also be made to hold the lower jaw forward. Again, I don't care what you get if you've got sleep apnea, but under no circumstances should you listen to your doctor if they say, oh, it's mild. Now, if they mean there are some apneic episodes and you don't have mild sleep apnea 0 to 5, that's a little different story. But if you actually have mild sleep apnea, 8 hours times 15, I mean, think of not breathing 100 times a night. It's crazy. Only 2/3 of people with sleep apnea are overweight. So 1/3 of people with sleep apnea are regular weight. And if you snore, I would absolutely get tested for it. If you don't snore, or you don't know, you don't have a sleeping partner, luckily you can turn your phone on at night and record yourself. If you hear yourself snoring, 20% of people who snore have sleep apnea. And like I said, 1/3 of people who have sleep apnea aren't overweight. So absolutely get yourself tested. This is the only thing that I might be able to help people with remotely. I offer them at cost in my office. It's a pulse ox, a watch, and a chest lead. I'd probably have to figure out what doctor in your state will give you the result, but that's one thing that I could mail to you. It's about the only thing I could do other than give you information. So I had a patient tell me once, they charged him $10,000. It was an in-study, like in hospital sleep test. There was a fire alarm in the middle of the night. They charged him 10 grand. They didn't refund him. They didn't retake the test. That was the most thing I've ever heard. So I started carrying them. They're $300. I do them at cost for people so that they can increase their lifespan or get a dental appliance covered by medical if they want it. So if you want that, you can reach out to me, 703-451-4500, Dr. Jason Dulac, dulacdes.com, www.dulacdes.com. All this info is on my main website, but absolutely, if you are snoring, I would get tested. One last one for fun.
What's the oldest human jawbone found, and what does that say about the age of humanity?
This story didn't get a lot of press, but a couple years ago, Dennis walked into his mother-in-law's house.
Looks at the travertine floor, that nice flooring that's like kind of a level above granite or marble or whatever. He's looking at the floor and he sees the cross section in that tile of a human jawbone kind of cut obliquely. And so they get that carbon dated 80,000 years. So irrefutable evidence that humanity is at least 80,000 years old. I hope you guys enjoyed this. I hope you got something from it. I hope this saves you some money that you can reinvest in other things. Thank you so much.